From here, we would want to look at the mechanisms of resistance. I've already mentioned that the popularity of the tetracyclines have declined as a result of resistance. So let's assume that these are your tetracycline drugs. And then remember that if there is resistance, it means that the organism is not susceptible to the action of the tetracycline, despite giving the right dose and the right concentration being achieved. So let's assume that this is our microorganism, and we have enzymes produced by the organism. Here, this is our ribosomal subunit that would help us in producing the proteins. Now, the drug has to enter in order to inhibit protein synthesis in the microbe. But how do we get the resistance? How is it possible that these microbes do not get to be killed, or their growth is not inhibited by the tetracyclines? So one of the things that happen is that when you have the tetracycline, it needs to go through some channels. Normally, we could call them porins, that would then allow them to get into the system. And these microbes are able to produce molecules that block, as we can see, block the entry of the tetracyclines. And so once the tetracyclines do not enter, it means that their concentration becomes too low in the system of the microbe to be able to inhibit bacterial protein synthesis. So that is one way, reduction in the entry of the tetracycline. There is another mechanism where the tetracycline manages to enter, but after it has entered, there are efflux pumps that throw out the tetracycline like we have just seen. So this is an efflux pump. And so by efflux mechanisms, the tetracycline that has entered goes out of the cell. So the concentration will be too low within the microbe to be able to inhibit protein synthesis. Then, as I showed you, this is an enzyme, and sometimes there is what we call enzymatic inactivation. And so the enzyme could go and inactivate the tetracycline that has entered, and so the tetracycline is not able to produce its effect. Its structure becomes destroyed or inactivated. And lastly, there could be ribosomal protection that ensures that the tetracycline is not able to bind to the 30S ribosomal subunit. Now, someone may ask, if the tetracyclines inhibit bacterial protein synthesis, what about the host who has the infection? Can the tetracyclines inhibit protein synthesis in the host? There is a possibility, but usually it does not happen. Although that possibility is there, the reason why it doesn't happen is because when the tetracycline gets into mammalian cells, the tetracycline is thrown out of the mammalian cells by efflux pumps. So it means that their concentration will be way too low to be able to inhibit mammalian protein synthesis. And that is good news for us, all right? So someone will say, but the ribosomal subunits in the bacteria are not the same as what you find in the mammalian cells. That is true to an extent. The ribosomal subunits we find in our mitochondria are actually similar to what you find in bacteria. So it is possible that these drugs could have inhibited protein synthesis in the mammalian cells, just that because they are thrown out by the efflux pumps, that is why they don't inhibit the mammalian protein synthesis. I hope this makes it clear. Now we come to side effects or adverse effects. We have gastrointestinally related adverse effects or side effects. We could think of nausea, vomiting, diarrhea, anal pruritus, or itching. We could think of oral candidiasis because the tetracyclines could eliminate the normal flora. They allow the growth of the fungi called, or the fungus called Candida albicans. And so that would create the possibility of the oral candidiasis. Then there could also be, in extreme cases, enterocolitis, which may come with shock and even death. In terms of teeth and bone problems, tetracycline could cause discoloration of the teeth because it forms a complex with calcium. It could also cause enamel dysplasia. There could be deformity or growth inhibition, deformity of the bone, and then there could be growth inhibition, especially in children. Then we could have liver and renal toxicity. There could be some vestibular dysfunction, which may cause loss of balance, dizziness, or vertigo. Then there could be photosensitization, in which case these people are sensitive to the sunlight or UV rays. And so for such people, if they give them tetracyclines, they would have to probably wear protective clothing and try and avoid the sun rays. In what situations can we not give tetracyclines? So that is what we call contraindications. So here we have pregnancy, because in pregnancy, the tetracyclines will cross the placental barrier, enter the circulation of the fetus, and form bonds with the calcium in the bone. There, it could cause deformity of the bone. Again, there could be a possibility of restricting growth in the fetus when the tetracycline is given to the pregnant woman. So usually we will not give tetracycline to people that are pregnant. Then in children, there's a possibility of restricted growth, side that the tetracycline could be deposited in the unerupted teeth, which later on could cause discoloration or fluorescence of the teeth. So we do not want that. Then in situations where there is renal insufficiency, usually we would want to avoid the tetracyclines because they could cause renal toxicity. The exception is usually doxycycline, which it does not depend on the renal system for elimination. And so even in renal insufficiency, doxycycline could be used. Lastly, we would want to look at drug interactions. Now, if tetracyclines are given together with some of these drugs, there could be issues. For instance, if you give tetracyclines with antacids or iron preparations, that is blood tonic containing iron, the substances in the antacid or iron could form chelates, complexes with the tetracycline, and that could inhibit the absorption of the tetracycline. So it will not be able to work well. Another thing is where tetracycline is given together with milk. Someone takes milk. Milk contains calcium, and so the calcium could form bonds or complexes with the tetracycline, inhibiting its absorption. So the tetracycline will not work well. Now, tetracyclines with penicillins. When you give tetracyclines with penicillins, penicillins usually need the bacteria to be rapidly divided in order for them to inhibit their cell growth synthesis. But when tetracyclines are given, because they are bacteriostatic, they inhibit the growth of the bacteria, so the bacteria will stay in a dormant state. And since it is not rapidly dividing, the penicillins cannot do their work. So we do not combine tetracyclines with penicillins. Then ergot alkaloids, like let's say ergotamine, which we would use in migraine, or ergometrin, which is used in postpartum bleeding. Now, these normally, when you give them together with tetracyclines, there could be increased levels of the ergot, which will increase the toxicity of the ergot. We normally say increased ergotism. This may actually lead to reduction in blood flow, which could lead to gangrene. Then tetracycline combined with methoxyflurane could lead to the possibility of increased nephrotoxicity. And then the same way, if you combine with methotrexate, there could be increased adverse effects from the methotrexate. Bile acid sequestrants may inhibit the absorption of tetracyclines. And when we come to anticoagulants, tetracyclines usually depress prothrombin activity. And by depressing prothrombin activity, it means that thrombin would not be formed and clotting would be impaired. So if we are giving anticoagulants with the tetracyclines, we increase the risk of bleeding. So usually we would advise that the dose of the anticoagulants will be reduced in order not to have the toxicity. Then tetracyclines could cause failure of the actions of oral contraceptives. The reason is simple. As the tetracyclines clear the normal flora, the tendency for your oral contraceptives to undergo what we call enterohepatic recycling is impaired. So the oral contraceptive would be cleared from your system faster than usual. So it is not able to give the protection that the woman needs. And so normally when people are on tetracyclines and they're also on oral contraceptives, they would need another protection, another form of protection in order not to get pregnant. Now, this all time would allow us. I'd want to say thank you for watching, and don't forget to subscribe to our YouTube channel, like, comment, and then share. Once again, this has been Prof. Sir Kennedy Edem Kukia. We'll see you another time. Goodbye for now.